UTIs can be extremely problematic for a lot of people. Today, we're going to discuss how UTIs are diagnosed, how to prevent UTIs, why women get UTIs more than men, when to go see a provider, and how we treat UTIs in clinic. Let's get rolling. Hey folks, welcome back to my channel. Stay to the end because I'm going to talk about some common treatment myths about UTIs. Hint, cranberry juice. Whenever you like, or if you have time, please like and subscribe if you like my content. That'd be much appreciated. Urinary tract infections, also called UTIs, are infections along the urinary tract. The urinary tract is divided into two sections, the upper urinary tract and the lower urinary tract. And the urinary tract consists of the kidneys, the ureters, the bladder, and the urethra. Infection in the bladder is also called a UTI or cystitis, itis meaning inflammation or infection of the bladder. When people say I have a UTI, 9 times out of 10, they're meaning a bladder infection. So for the sake of this video, I'm gonna say UTI, meaning a bladder infection, but remember, a UTI can be any infection along the urinary tract. On the other hand, I do want you to know about pyelonephritis. Pyelonephritis is an infection of the kidneys, and sometimes this is an emergency where you need antibiotics as soon as possible. If you don't, some people actually die of a kidney infection. And fun fact, kidney infections can come from an untreated bladder infection that makes its way up the ureters into the kidneys and causes an infection. But remember, today we're really just going to focus on a bladder infection, and also remember, we're going to call it a UTI. Symptoms of a urinary tract infection can be pain with urination, urinary frequency where you're peeing more often, urinary urgency where you have the feeling that you gotta pee but don't, bladder pain, and also hematuria, which is also called blood in the urine. Some people usually only have around 1 or 2 symptoms or no symptoms at all. The individuals who have no symptoms, that's pretty rare, and we usually only see that in the elderly population. And usually what happens is an elderly person comes into the ER, we can't figure out what's going on with them, they have a fever, they're overall not feeling well, we get a urinalysis and come to find out they have an untreated urinary tract infection. But again, I'm gonna mention, if you ever have any back pain, pain with urination, a fever, just overall feeling ill, we're worried about a kidney infection, pyelonephritis. That needs to be treated as soon as possible. The next topic is probably the most common question I get in clinic, and that's why do women get UTIs more than men? And the reason is simple. The urethra, remember the urethra is that tube that goes from the bladder to the outside of the body. That's the route that urine takes to go from the bladder to the exterior aspect of the body. That tube is 5 centimeters in women, around 5 centimeters. And in men, it's 15 centimeters. That's 3 times longer than in females. So it makes sense, right? Bacteria that goes into the tip aspect of that urethra is very much shorter in females than in men. As a result, this leads to more bladder infections, UTIs, in females. The most common bacteria that causes urinary tract infections is E. coli. And you may be thinking to yourself, doesn't E. coli come from contaminated beef or contaminated spinach or eggs? But there are several different strains of E. coli, and E. coli can cause infections in various different areas of the body. On to the 4 great ways to prevent UTIs. Number 1, drink plenty of water and relieve yourself often. This is a very easy concept to remember because if bacteria gets into the bladder and you're hydrating really well, you're flushing that bacteria out. And when you're relieving yourself often, you're also not allowing that bacteria to marinate in there and cause an infection. Number 2, wipe from front to back. This may seem common sense in women, and you probably learned it a long time ago, but it makes sense, right? You don't want to bring that stool and bacteria up to the front of the vagina into that urethra and cause an infection. Not only is that bad, but it's actually pretty gross. Wash up before and after intercourse and urinate after intercourse. This is important because during intercourse, there's a lot of rubbing against that urethra, and there's more of an opportunity for that bacteria to get in the urethra and get into the bladder. So in essence, if you're washing before and after, you're reducing the amount of bacteria. Also, after intercourse, you want to urinate so you can push out that bacteria to potentially stop an infection from starting. All right, next you need to steer clear of any irritating feminine products. This is very important. Avoid douching, different fragrances, different powders, because this can cause excessive irritation in the genital area, thus leading to a urinary tract infection. Whenever you're cleaning down there, use a fragrance-free soap, just a little bit, in warm water. That is all you need. Diagnosing a UTI is very simple. All you gotta do is schedule a visit with your primary care provider or go to an urgent care or an ER. And what happens is you urinate in a cup, we send that off for evaluation to determine whether you have a urinary tract infection or not. Once we know there's a UTI, we send that urine for a urine culture. A urine culture is great because what happens is we're able to culture out that urine and figure out what specific bacteria caused the urinary tract infection. Also, we do what's called a susceptibility, and a susceptibility is when we figure out what antibiotics work on the specific bacteria that a person may have. But the problem is the urine culture and the susceptibility usually takes several days to come back, so we don't know that information right away. There is different over-the-counter tests that you can take to determine whether you have a urinary tract infection or not, but the problem is there is no urinary culture that you can send out. Also, if you do have a urinary tract infection, it needs to get treated. So the best thing is if you have symptoms, go see your primary care provider. Treatment is simple. We use antibiotics and we pick them based on the most common bacteria that causes UTIs. So if someone has a simple acute cystitis, a UTI, we start a medication like macrobid for 5 days. And this works for around 80 to 90% of people. When the urine culture and susceptibility comes back, we're able to confirm that the antibiotic that we chose works on the bacteria. But sometimes there is a bacteria that is resistant to the antibiotic that we chose. As a result, the susceptibility tells us which antibiotics will work on that bacteria, so we end up changing the antibiotic regimen. Finally, we all heard about the potential myth that cranberry juice and probiotics help prevent or treat urinary tract infections. Over the last decade, there's been tons of research on whether cranberry juice and probiotics actually help with preventing or treating urinary tract infections. Honestly, there have been mixed results. Some studies noted mild benefit, but a lot of those studies weren't performed very well. On the other hand, there was some studies that showed no benefit. So the question is, will it help or not? And we just don't know whether definitively if it helps with preventing or treating urinary tract infections. On the other hand, we also have to remember that a lot of people struggle with urinary tract infections. And if they want to try a benign therapy like unsweetened cranberry juice or probiotics, if it helps them, then great. If it doesn't, then that's fine. This is a major concern of mine because over-the-counter azo only treats symptoms of a urinary tract infection. It does not treat a urinary tract infection, and it is not an antibiotic. Sometimes I get patients that come in and they're like, hey, I took over-the-counter azo and this usually treats my urinary tract infection, but this time it didn't go away. I always have to reiterate, azo does not treat a urinary tract infection, only antibiotics does. So if you have symptoms of a UTI, please go see your provider and get treated appropriately. If you have time and you like this video, please like and subscribe. Also, if you have any questions, don't hesitate to leave a comment below. That wraps up today's video on UTIs. Until next time, take care.